Tēnā koe menita, tēnā koutou katoa, he mihi mahana ki a koutou, ko Ngāti Kahungunu, Ngāti Porou, ko iwi ko Tristram Ingham aho. Thank you, Minister, and for your opening words, and to Mark for your introduction, and to the Ministry of Health for the invitation to speak here today. We've heard a lot over the last day and a half about how the health and disability system is inequitable and unsustainable. It's a system under strain and a system that needs to change. And we here, the people in this room over these 2 days, actually really effectively represent the majority of that system. And so this is really an opportunity for us to reshape that system and for person-directed care or person-directed support to be a key vehicle to drive that change. I say ready or not, here it comes, because disabled people are finding our voices, and the level and advocacy and passion in the community is rising, and the ministry, central government, is picking up on this, and legislative, policy, regulatory changes are coming that will support this movement. So it's a time for organisations to get on board the waka, as the Minister said, and really lead that change in parallel with us. We've all seen this diagram before, people watching a game, looking over a fence, and the point of the diagram makes the point that we need to distribute resources and supports to allow each person to fulfil their true potential. Equity over equality. But it can be easy to overlook a key aspect of this graphic. Who built this stadium? Who would build a stadium that only 1/3 of the people can see the game? And so really, I think this is where it calls into question person-directed support as really a vehicle for not only a human rights approach, but actually just simply a quality framework. If we designed a fence in partnership with the communities that we're serving, we can design a fence that doesn't require those supports. Because those boxes, we've built a whole industry around building boxes, moving them to the right place, lifting people on and off those boxes. And inevitably, the boxes aren't in the right place at the right time. We don't have enough boxes, and no one's really happy. If we had started from a premise of the people who use the system were integrally involved in the designing of that system, we would design a system that not only met their needs better in the first place, but would save us a lot of work. And I think that's a really critical image. When we're talking about these fences, we're talking about quality. We're talking about processes. We're talking about the complexity that the system has. We've heard over the last 2 days, the system is very complex. That complexity is the fence. It's that complexity we have to remove. And I guess my question is, what actually drives quality and innovation in a system like ours? Take the metaphor of this communist architecture. In any monopoly or where a consumer or market economy doesn't drive that competitive change, a system inherently tends to become functional rather than inspired. So how do we get to a point where we subject our Uber drivers to more quality control and customer feedback than our health and disability service providers? How does that happen, and how do we bust out of that? Because I'm going to challenge us with the notion that the system is performing exactly as it was designed. But it's because it's a system that was created and evolved by the providers primarily to support the focus of their needs, their efficiencies. So why would we expect a different outcome? And so this is where I think person-directed support is not only just a means, but an opportunity to change our organisation. We need to identify levers, and finding levers in the system is a critical step, and one that's been quite lacking at all levels. But with wicked problems like this, there won't be a single solution. They require a concerted effort. We have to not only make the problem understood, and this forum, I think, represents the ministry doing its part to try and engage with the sector in general to actually make the problem more understood and not bring a solution, but to start the conversation and actually ask the sector for those solutions. So we're asking you to identify in your organisation, what are those levers? What can you do to break down those barriers? I want to give you an example, an opportunity, in fact, around the implementation of best practice. And this is something I've been involved in through the DPO Coalition, the Disabled Persons Organisation Coalition. So this is an example of government working with disabled people in a partnership relationship to implement the UNCRPD, so the UN Convention on the Rights of Persons with Disability. This convention is in effect in New Zealand. It is legally binding and international law on all state parties, so government, and all government-funded organisations. And its purpose is to ensure the full and equal enjoyment of human rights and fundamental freedoms by all persons with a disability. And in health, so specifically relevant to this sector, there is a whole article on the rights of disabled people, and that includes to the highest attainable standard of health, with not only mainstream health services, but also disability-specific health services and habilitation and rehabilitation programs. Programs that are close to home and that respect the inherent dignity of the individual. There are a number of other articles in the Convention that are also specifically relevant to our sector, that our services must be accessible, that our staff must be trained in how to work with people with disability, that our materials, our information forms, etc., need to be accessible in forms, and that other technologies are available to support those interactions. Legislatively, regulatory, this is already in place. There is nothing that stops each one of our organisations from taking this forward tomorrow. Article 4.3 of that same convention talks about the requirement and gives us a clue to the person-directed support element of this, that in the development and implementation of not only legislation and policies, but in other decision-making processes concerning issues relating to persons with a disability, that the representative organisations or disabled people themselves must be closely consulted with and actively involved. So what does closely consult and actively involve mean for you, for your organisation? So I want to just leave you with a glimpse at what a checklist might be, because I'm sure if I asked, most of you would say you're committed to working in a genuine partnership with consumers, disabled people, tangata whakaha. So what does that mean? What in your organisation's governance structure do you have to actually support that top-down leadership? 24% of the population have a disability. How is your workforce in terms of its disability makeup? After all, if we can't make health and disability services such that they can meet the reasonable accommodations of disabled people, how do we expect any other employer to do so? In the commissioning of your services, how many of your services are actually co-designed, co-delivered, and co-evaluated with service users or disabled people. And just like the Uber driver, what do you have in the way of robust quality feedback mechanisms so that those consumers, those disabled people, can actually give you their feedback? We know that organisations need help to be able to move forward to this kind of way of thinking. And so we're really encouraging significant community stakeholder partnerships. How many of your organisations have relationships with disabled persons organisations or kaupapa Māori providers or other NGOs to kind of fill the expertise gaps that you're having? And just really finally, I think there's a number of key success attitudes that you've heard about from the previous speakers that are really going to underpin this. We need to recognise that consultation is no longer adequate, that we really need each organisation to truly know its community and go beyond the usual suspects that you might have brought in on the promise of a petrol voucher or a morning tea for a consumer support group. We really need to recognise and remunerate the lived experience skill set of the communities that we're talking about, and really be open not only to the input and critique that may come, but actually to recognise that we don't, as providers, need to have all the solutions ourselves. We need to bring the problem to the table and come to the table as equals so that we can work on the solution together. Kia ora koutou.